and welcome to Health Quest. I'm Kurt Hill, your host this evening. This show proves to be not only provocative, but quite special. At least special to me, because the person I'm interviewing this evening has been in your home and mine and in my life for quite some time, and she is gracious enough to bring us her story, one that not only affected her, but as you listen, you'll understand why it affects all our lives and why it's very, very important to know just what we really want and how we really feel about ourselves. Well, listen, I'm not here to talk about what I think. I have a chance now to ask Deborah Arneson, our guest for this evening, about a few things that happened in her life. Deborah.
Yes.
Hello and welcome.
Welcome back to you, Kurt. Back at you.
It is so good, and I'm so happy, as I've said so many times, that you're doing this particular show.
What was your idea? And you know what? I thought about it. It's a good idea.
Well, thank you.
Yeah, thank you.
So as you well know, Deborah and I go back quite a ways, and we've done many a show here, and it's like homecoming. But no matter what, I could have been across the world, I would have come back for this. I would have come back to talk with you, and I think it's so special that she's gifting you this particular show. I have some questions for you.
Okay.
Okay, tell us about your story.
Okay.
The why me?
The why me scare. Well, it's a year ago, May, I think it was, or April. So it's coming up on a year. I was actually at the movie, you know, and I massage myself while I'm sitting around. Nobody else will do it. No, I'm just kidding. So I'm massaging myself, you know, and I'm doing this little neck thing that I do. You know, get a lot of stress here. And so I'm like, you know, doing this little rub on my chest, and I feel a nodule on my left breast about 2 inches above the nipple. And it was like way deep, and it was a little hard, like less than the size of a pea. Really small. So I was speaking to my daughter, and she said, you know, she was having a baby at the time, and she said, why don't you come up north and see the doctor up here? Because I really had pulled away from my doc. Every time I go to see a doctor, they want to do surgery on me. It's just something I bring out in doctors. So I was like, yeah, I don't really have a doctor. I don't want to go back to my doctor. I won't name names. And she says, well, come see this guy. He's really good. He's a North Shore doc. So I went up there, and I was, you know, told him I wanted to do a fine needle biopsy right away. And that's all I wanted to do. So I went and saw him, and he was running late, didn't do the fine needle biopsy, did an exam, and said, you know, you need to go do a mammogram. I said, I don't want to do a mammogram. I don't believe in mammograms. And he said, well, you know what? No one's going to look at you until you do a mammogram. So like snowballing me. And I said, you know what? I was told you'd do the fine needle biopsy, and that's why I'm here. That's solely why I'm here. He goes, well, the lab's actually closed right now. We couldn't get the results today anyway, and I'm not comfortable doing it until we see if the mammogram shows something, you know, interesting. And I said, well, you know what, that's enough of that. So they did a pap smear and whatnot and screwed that up. So I was like, that's the end of that, doctor. So that was my first encounter. And
now let me ask you this. That was your first.
Right.
How many doctors did you actually see to get 5?
5, yes.
5 doctors to get clarity.
Yeah, well, because they were all crazy as far as I was concerned. So then I talked to one of my best friends, Christy, whom you know, and she said, we have the best breast doctor in the city of Chicago. He's an oncologist, and he's over at Rush Hospital. So I went and saw this man again. I won't name any names, but I wanted to schedule an appointment with him. She said, he's so nice. He'll talk to you on the phone. You'll describe it to him. He'll tell you, probably on the phone, that it's nothing to worry about. Well, I couldn't get near him with a 10-foot pole. I couldn't get him to return a phone call. His nurse called back, like, I think, a week later, and I said, well, if nobody else here is worried, I'm not going to get worried either. So his nurse called me and said, doctor will not see you, talk to you, visit with you, nothing until he has an ultrasound and a mammogram in front of him. So I went to a place on Michigan Avenue and did the ultrasound and the mammogram. And while I was sitting in the waiting room, you know, I'm like, oh, no, just get me out of here. I did my bone density while I was there, and I see a bunch of girls, I have to tell you, much younger than me, probably by minimum 10 to 15, 20 years. In the course of my waiting for my turn, at least, I'd say 5 of them came and left, and they all left crying. Like they'd been given really bad news. And I was like looking at this going, this cannot possibly be what I think it is. All these girls can't be walking out of here with the information that they have a concern of breast cancer. So I go in, and the doctor does my, the tech does my ultrasound, and she calls the doctor in, and they redo the ultrasound. 3 times. They redid the mammogram 4 times. So by now, my poor breast has been mangled as far as I'm concerned and radiated far too many times. The first doctor comes in, and she says, you know, I'm 95% sure this is cancer. And I was like, are you out of your mind?
Wait, the doctor came in and said
Yes.
she's 95% sure that it's cancer
That the
at this
system-
point.
Right. So I said, well, you know, I think you were really wrong about that. And I said, what makes you say that? She goes, well, see the way it looks like it's splattered? And it's the type of a cyst that looks like it's been like a paintball, been splattered up against a wall. I said, well, you don't understand me. Like when I found it, I started digging really hard and trying to smush it down because I figured it was a swollen lymph node and probably had, I'm real mucusy. And I thought, well, maybe I have some mucus in here. And I said, I probably smashed it. She goes, no, I'm very sure. She goes, because this is always cancer when it looks like this. I said, you know, you don't understand. First of all, I do colonics probably every third week. I eat more vegetables in 1 week than most people eat in 2 or 3 months. I said, I eat fruits, I exercise, I meditate. I said, I'm not on estrogen or hormone replacement. There is no cancer in my family, either side. I said, and I've had a child, and, you know, I mean, I could go on and on and on. The litany is too long. She goes, well, cancer doesn't discern. And I said, well, you know, I think you're wrong.
So, in other words, what you had to say, you were completely invalidated.
Oh, totally. Then they called in the head doctor who came in and said not only was she 95% sure, but she was 98% sure. Well, by now I feel like a deer in headlights. I'm like, you got to be kidding me. I mean, how could I not know something is wrong with my body? Because I'm really in tune with my system. I'm very sensitized to it. And I take a lot of care with my system. And it's not something that happened overnight. It took me 20 years to get here. I used to be a little, you know, pig pen. I mean, I ate French fries and drank Cokes in my 20s and did a lot of like hazardous things. I never drank and did drugs, but I did eat really bad food for some time there. Donuts.
So you weren't always a nutritionist?
No, darling. I had a daughter who begged me not to feed her McDonald's when she was 5. How's that for not a nutritionist?
Let me ask you a question here, though, before you go on.
Sure.
Is it good to shop around for doctors?
Oh, absolutely. I think, you know, first of all, you need to find a physician who will listen to you and who will hear you and has a concept of what healthy living is about. I mean, you know, how can anyone understand where you're coming from if they, in fact, aren't relatively healthy themselves? You know what I'm saying? If they got a cup of coffee next to you and they're interpreting your mammogram, I mean, good chance that this person is an accident waiting to happen eventually as well. And that's probably not her first cup of the coffee since that was 2 in the afternoon. So, so then what happened is they called the doctor at Rush and said, you need to get her in now. You can't wait another 2 or 3 weeks. So they moved my appointment up to Monday. I went with my daughter. And we were sitting in this doctor's office, and he's got this really beautiful office. I must tell you, it's all like Ralph Lauren fabric and, you know, top of the line. And he puts me in the exam room, looks at the ultrasound, looks at the mammogram, palpates, you know, the breast area, palpates the lymph area up here, and takes me into his office and sits down with me and with my daughter sitting next to me and says, not only am I 95% sure, I'm 100% sure you have breast cancer.
Oh, my goodness.
And I was like, excuse me? And he said yes. And he goes, and I also think you have at least stage 2 to stage 4 lymphoma.
My goodness.
And you know, if that's the case, then we're looking at 2 years. And now I'm like, I'm going to throw up all over your frickin' desk. You know, what are you saying to me here? And he goes,
now, Deborah,
I know.
knowing who you are and knowing that you brought nutrition advice into homes all over the United States and, for this matter, internationally, that wasn't taken into consideration. All that you were telling them about your diet wasn't taken into consideration.
No.
Hearing that,
No.
what was your mindset at this point?
I was really PO'd.
Yes.
I was, first of all, I felt like someone had slugged me with a sledgehammer.
Yes.
You know, I mean, when he said that he thought I had lymphoma, I said to him, I said, you know, forget about breast cancer. What are you telling me here? He says, well, I feel a swollen lymph node up here by the clavicle. And I said, listen, this nodule, no one has been able to find it, including you, until I pointed it out to you. I said, this up here, show me where. He goes, well, right here. And I palpate. I said, there's nothing there swollen. I said, I would feel that. He goes, well, my hands are experienced. Yours pretty much aren't. So he had kind of a cocky attitude, and I took great offense to him. And I said to him, you know, I said, he goes, here's what I want to ask you. He goes, what we're going to do is we're going to go in and we'll do surgery on you. And now you know, now it's a train running wild. He goes, we're going to do surgery on you in a week. He says, we're going to go in, we'll take out the tumor. I said, it's not a tumor, it's a cyst. He goes, no, it's a tumor. He goes, then we will go in and we'll take out the sentinel node. Now, I didn't know what the heck a sentinel node was. And he, you know, a sentinel node. And he goes, that's the node that protects the rest of the lymphatics. He says, and if it's in the sentinel node, then a week later we'll bring you back in for major surgery again. I said, you want me to take anesthesia twice? I said, I don't do anesthesia once well. He said, then we're going to take out 15 of the nodes. He says, do you want to keep the breast or you want to let it go? Just like that. And I looked at him and I said, I swore at him. I did. I said, who do you think you are talking to me this way? And he goes, I know. It's really nerve-wracking. This is really distressful for anyone who sits in your position. I said, how would you know about what position I'm sitting in? You're creating it. I said, you know what?
That's a good point. The compassion, you didn't feel any. It wasn't there.
Are you kidding?
At this point.
And this guy, can I tell you, since then, I've had a couple of women who've been to him, and I advised them not to go to this doctor.
Mm-hmm.
And since then, they did go to him. They felt like a lot of the surgery that he did do was completely erroneous and unnecessary. So I was just a big ticket item. You know, I was the washer and the dryer instead of the microwave. That's how I felt.
Yes.
Okay. So
Yes.
I ended up, I said, give me my charts. I'm leaving here now. And he goes, well, where are you going to go? Kind of cocky. I said, I'm going to go see Dr. Descupta over at University of Illinois. I hear he's one of the best. And he did like a triple blink. So I knew I had him. And he goes, well, fine, like that. So I took my chart, I left, never to come back to this guy. So I went and saw the next doctor at 1 o'clock that afternoon, and a good friend of mine had gotten me in to see him. And he actually picked up the phone and talked to me, this man.
Can I interject something just right here as I'm listening to you? Something that I'm just amazed with. I'm in awe of, to be honest with you. What a gift. I mean, just how many people at that point, myself included, getting that kind of traumatic information would have just been frozen. And then you're listening to an authoritative figure just tell you about yourself with no compassion, no care, quickly making a decision. I'm just, it's just amazing to me.
Well, actually, at one point, I did say to him, you know, do I look like your ex-wife or something? Before I said, give me my chart. And my daughter's like, Mother. And I'm like,
no, this is a
and
situation where you're fighting for your life. Oh, I see.
And because I saw all these blonde-headed kids on his desk, and I thought, well, maybe he doesn't like his wife or something, you know. But you know, you look to these people as experts, and I have to say one thing about the medical industry is that they parrot the same information without ever stepping outside of the box. And I think that is so unfair to the patient. Do no harm. Hello, you know, horribly harmed.
That's a good point.
Horribly harmed.
Now you're taking allopathic methods at this point, medical doctors. Alternative at all?
Well, yeah, I'll continue with what happened with the biopsy, and then I turned to alternative after that. So I went to Dr. Descupta, who actually is a delightful Indian doctor over at U of I, has a very compassionate and caring team. I mean, I would actually suggest him to anyone who wants to go to, and I heard that he was the kind of doctor that would not do chemo unless it was desperately needed. He would do everything he could to keep chemo away from you. So I said, well, I like the attitude of the man, you know, just from hearing about him. And he'd had some really good reports from other sources. So I went and saw him, and he's like, I will tell you when it's time to start worrying, you know. And I was like, well, tell me it's time not to start worrying, and you and I are going to be best friends here, you know. So I've got my daughter, my best friend with me. His nurse was delightful. And he said, we're going to first do a biopsy. And I was like, you know, I've read about this a bit. If you do a biopsy, and it is a problem, I've heard it can spread it very quickly. And he goes, we're going to do a fine needle biopsy. We'll do 3 biopsies. So they lay me on the table. The guy comes in with this gun. It looks like a dart gun. It's huge, a big Korean doctor, nice man. He goes, oh, honey, he goes, you know what? You just don't have the look. That's what he told me. And I said, I love you most of all, you know, and he goes, I said, why do you have such a long needle there? And he was like, well, don't worry, we're just going to take a little biopsy. And I said, okay, you know what you're doing with that thing? And he was like, yes, I do. So the nurse is holding my hand, shaking me. I'm like, would you stop shaking? You know, she's a wreck. So he does 3 punctures into, you know, the little cyst, and we wait an hour to get the results. It comes back inconclusive. Now I'm saying, okay, you're either pregnant or you're not pregnant. You either have a problem or you don't have a problem with cancer. You know, what do you mean inconclusive? He goes, well, he may not have gotten a good sample. I said, excuse me, we're not shooting for the center of a peach or a baseball. We're shooting for the center of a pea. unless
Yes,
he's a really bad
yes.
shot and he needs his eyes checked, he should get out of the business. You know, we got a good sample here. He goes, well, there's fatty necrosis around the tumor site. I said, you know, I got elbowed in that breast about 10 years ago. I was sitting in a restaurant, two guys at a table, you know, got into a fight, took a swing, and he elbowed me here, and I had a lump there for a few years. So yes, there would be fatty necrosis there. And that lump had gone away. And he said, well, a lot of people get kicked, and next thing you know, the bruise doesn't completely go away. It develops into a problem, becomes cancerous or whatever. And I said, well, you know, if it's coming back inconclusive, I don't think I'm going to do the surgery. He goes, well, I'm going to recommend that you take it out. And I said, well, I don't really like anesthesia. I don't do well with it. And he goes, you know, we have the best anesthesiologist. So he listened, and they talked, and he spent probably 3 hours with me, which I was so appreciative of, because I know he's got a line out there, a waiting room a mile long of people with cancer. You know, because when you see the waiting rooms, that's when you're just like, holy, you know what? What the hell is going on in this country? This is so scary, all of this. So I didn't have him sign an agreement with me, but he made a promise to me that he wouldn't take out the axillary lymph node unless there was a problem with the cyst, which he was calling a tumor. So if there's cancer here, then they take out the axillary node, the sentinel node. Well, I went in for surgery, and before the surgery, this was like the following week, before the surgery, they wanted me to sign all the disclaimers. And, you know, they've got a different doctor doing this and a different doctor doing that. Well, unfortunately for me, I had gone to see Dr. Shambhu, who was our Indian doctor from India, and he started using this liquid medicated ghee that I was taking. I stopped all sugar, because, you know, I like my sugar.
Right, right.
I looked great before the surgery, even though I was a train wreck. And he was doing mud packs, these herbal mud packs on the breast, and the thing shrunk down like in 2 or 3 days because it had been poked and prodded so much. And he said, Deborah, cancer doesn't shrink this fast. He goes, it's a cyst. And I said, well, then I'm not going to have it taken out. He goes, I don't want to get in the middle of your medical community. He goes, I don't want to be responsible. He goes, if it's a cyst, you don't need to take it out anyway. I said, but I don't do well with anesthesia. I'm whining. And he's like, just take it out. So I had done the non-allopathic treatments for about 2 weeks before the surgery. I felt great. I'd never looked better, but I'm a train wreck because I can't handle anesthesia. I get really sick.
And you know that about yourself.
Yeah.
You're clear. And it's important at this point to bring out that you work with people on an ongoing basis. You have a practice.
Right.
You see people. You've been faced with having to talk with people who are in their terminal stages of cancer.
Right.
I've worked down the hall from you, and I've listened to your compassion, your care when you've dealt with people. So this is no stranger to you at all. It's not that you were just being recalcitrant about what they were saying.
Right.
It was the presentation and the proof and the invalidation.
And sitting in that seat.
And sitting in that
You know,
seat.
because there's a great deal of anger and there's a great deal of second guessing yourself. I called it the worm. You know,
Okay.
the worm gets in your brain and you do this like, what if they're right? Well, the hell with them, they're not right. You know, what if they're right? You know, that kind of a thing. So I actually took biofeedback and neurofeedback from an associate of mine, and it was enormously helpful. She didn't really know what was going on. We were doing a cable show. It was Ann Rickman, who has a biofeedback center.
Yes.
And she looked at me one night, and we were doing the show, and I explained to her what was going on, and she says, you know, I have a cyst like that in my neck, and it's splattered. It's been there for 20 years. It's not a problem, so I don't know what the doctor's telling you that for. So I went and saw her 3 times before the surgery, which really helped my brain calm down. And I took Shirodara and Panchakarma, which really helped me to calm down, because I don't do well with fear at all. You know, I've worked really hard to get out of a fearful place. I came from a fear environment when I was a child. So it took years of crawling away from that and really putting myself in position of peace and calm and faith. You know, and you have to work hard to get there for years, and now I'm there. So like being thrown into fear headlights was just like, oh, I can't live like this.
And the other thing is, and don't trust your instincts. Trust ours.
Right.
Very interesting
I don't
position
believe
to be
you can
in.
turn your life over to anybody. You really, you know, there comes a time sometimes when you may have to, but don't stop until you hear it. Because honestly, when I was going in for surgery, Kurt, another doctor had done what we call they do shots of dye underneath the nipple before the surgery to take a picture to see which is the sentinel node. And he goes, oh, you have 2 sentinel nodes. I'm like, I know, I'm an extraordinary human being. However, he goes, well, this one up here is real deep underneath, you know, the clavicle area and the rib. He goes, we'd really have to dig to get it out. And he said, and then you've got the one under your armpit, so that's the one we'd probably take it from if it's a problem. But the injections into the nipple were the worst pain I've ever had.
I would imagine.
He wanted to do 6 shots. He got to 4. I was like, touch me again. We got a big problem here. You know, my girlfriend's fainting next to me. I'm like, you can't faint. I'm supposed to faint. You know? But so then when we went into surgery, they wanted me to sign the disclaimer.
Now, wait a minute. You're headed to surgery. Wait. What made you decide to remove the cyst? With all this debate going on in your head,
Dr.
the
Shambu,
worm.
actually.
Actually, he did.
Yeah, he said, you know, it's there. You don't need it. Get it out. So.
How kind. Okay, so there you are.
How kind. I was
how
just
kind.
like, that's
that
not
he
the
would
answer
talk
I
to you.
wanted.
Well, not the answer, but there he is talking with you about something that you had to make a decision about.
He was great, actually. I have to tell you, if he hadn't been in my clinic visiting, you know, for that period of time, I don't know what I would have done because, you know, you're alone a lot. I live alone. So,
Yes.
you know, I really have total empathy for the women and men out there who are going through this, and they're going through this, God forbid, alone, without one person. Because most people are afraid of cancer, they're afraid of death, they're afraid of anything. They don't like hospitals. So most people aren't going to join you on that journey. You know what I'm saying? He was there every step of the way. And my girlfriend, Julie, Mike Tyler's wife, she was just wonderful.
Yes.
So I said, Julie, you make me laugh, keep me laughing, okay? Distract the daylights out of me here. And Dr. Shambu was, he'd go, oh, you got that look, let us talk, you know? We'd start talking. So we'd talk about allopathic medicine and the way Western medicine works versus natural medicine, and, you know, the ratio and how many times doctors are wrong and how doctors bury their mistakes a lot and stuff like that. So I was like, well, don't tell me about that now, you know? But it turned out that the surgery was supposed to be an hour long. It turned out to be a 5-hour surgery.
My goodness.
I know, which was
Now,
disgusting.
before we get to that, how did you choose your doctor?
I chose Dr. Zascoopta by the fact that he returned my phone call and spoke to me on the phone, and then I met with him and he talked to me more and he explained everything. He didn't leave it up to anyone else. And he was the one who said to me, I'll tell you when it's time to start worrying. So he didn't say yes and he didn't say no. I asked him about the lymphoma issue.
Yes, yes.
And he palpated and he said, no, there's no problem with
So
your
he
lymphatics.
spoke to you.
Yeah.
See, that's so important.
Looked me in the eyes,
Yes.
and answered the question.
So you felt like a human being,
Yeah.
even though you had what could be a problem,
Right,
maybe,
right,
but he spoke to you.
right. Sat
That's
down
so
with his
important.
team and your team and answered all questions.
Yes.
And didn't rush you.
Good.
Amazing.
5-hour operation.
Well, they want you to sign a disclaimer. And I said, you know, because my brother called me and said, Deb, you need to do your homework on this. You got to see what the options are. You need to know what kind of protein gene there is in this particular type of cyst or tumor. And that will determine A, if it spreads, B, what drug will treat it most efficiently, C, if your daughter is at risk for developing this as well. So I went to the table with all these different protein tests, gene tests that I wanted done on the tumor. And the doctor looked at me and goes, we don't do those tests here. I said, well, you're a teaching university, you should. And he said,
Good for you.
we don't. I said, then send them to U of C because they do them there. And, you know, I just for a split second, Kurt, had a feeling if I hadn't sent it out, who knows? Call me paranoid, but who knows? So I said, go back and change this. I want these different genes tested on this particular type of cyst or tumor, whatever it turns out to be. If you're right, you're right. If I'm wrong, I'm wrong. So I wouldn't sign it until he, in fact, went back and retyped this into signing my life away, basically. So he took out the lymph node, which really was distressing. He said it was swollen and impacted, and I said, well, you know, it's supposed to be swollen. After you inject, you know, 6 cc's of radioactive blue dye into my breast tissue, the lymph node works harder and takes up the garbage. So I would imagine it would be swollen. I said, you know, if, you know, your was swollen, would you chop it off? I don't think so. And he was like, oh, no, I don't think so. But I was distraught about that, you know, because this surgery actually hurt and my whole back ached for months. I don't know what they did with my arm. I don't know. And it's still, I still have problems.
Yes.
This is really in bad shape over here. So, so they did the surgery. I came out 5 hours later and they looked at me and I said, why'd you take out the lymph node if the tumor was negative, you know? Because he said, you know, it was nothing, it was benign. And I was like, it was benign. So I was right. He goes, yes, you were right and we were wrong.
How did you feel at that point, though?
So relieved. As I was vomiting, so relieved.
Yes. Yes.
So
Deborah,
relieved.
I'm still just so amazed
Ugh.
that you
I
had
wouldn't
the
wish this on
wherewithal
anybody.
to interact
Yuck.
this way, just to talk to people. And say, I mean, most times you have a team of professionals saying, look, you don't know what you're talking about. I know all about it, and it's your body.
Right.
And you had the courage to keep asking.
Well, you know,
and
I
fighting for yourself.
wasn't as courageous as I probably should have been. I actually was somewhat paralyzed because my brother said, you need to research this. I said, I can't. You need to do it for me. So my brother FedExed me a sheaf. He's out in Algonquin, a sheaf of papers like this. He's my little hero. He said, read this stuff. I was so angry. I didn't read it till 2 nights before surgery. And I was so angry, I didn't pray until the night before surgery. I had my whole family praying for me. They were probably rattling the cages of St. Peter's Gate, you know. But, because...
I'm getting signals here, so I want to ask... Not yet. I want to ask a very important question.
Sure.
I know our audience wants to know if there's a special diet that you chose after surgery.
Oh, yeah.
Yeah.
I actually did a lot of research on foods and antioxidants and breast cancer care, and I think we're going to be doing another show on some of that. But probably one of the best foods you could probably do are green vegetables, and a lot of people don't like them. They don't get them. They can't get them. They won't eat them. So there's a product that I actually take every single day, and I take 3 tablespoons a day. It's called Green Magma. And it's organic green barley grass. It's packed with enzymes, and it's just one of the best things you can do. 1 tablespoon is equal to 2 cups of vegetables.
It's marvelous.
Without the fiber. You need the fiber, so you got to get someplace else. But at least it's a start, and it helps to change your pH from slightly more acidic to, you know, more alkaline, which makes you less of a breeding ground for cancers and bacteria and viruses and parasites. So the best thing you can do is shift your pH a bit. Get off of sugars, where, you know, 110 grams of sugar will bring your white blood cell count to its knees for 4 to 5 hours by 80%.
Oh, my goodness.
110 grams of sugar, which would be a can of soda.
1 can of soda. My goodness.
Yeah, so sugar's the good precursor to setting yourself up for disaster.
I'm going to start finishing up, and take a deep breath. Whoa, that's a lot.
Yeah,
How you doing?
Good, thanks for asking.
Just, you know...
Well, it's good to share this. You know, I really want people to be proactive. And, you know, I guess we really never came public with all this stuff because it's been so dang busy. But, you know, you really need to keep going until you find someone who marries with your mindset, who treats you with respect and with dignity.
Well, you know, one of the most important things that I heard is don't give up your life to another. Believe in yourself. Trust your own instincts. There's a lot more to ask Deborah. What a gift for her to come forward and tell us about this. Tune in to me next week when I'll continue with Deborah Arneson on this Why Me subject. Thank you so much, Deborah.
Thank you, Kurt.
My goodness.
Yeah.
My goodness.
Turned out good. Woo.